bone has not moved in a while. When my butt comes off the chair, I'm working way too hard. There you go. Nobody should be contacting and thrusting into your lower neck.
So I should stop doing that.
We gotta, yeah, you're injuring
Okay.
yourself more. Gotcha. Okay, easy, I got you. Relax here. Yeah, okay, we'll get it.
Don't be afraid to go hard now.
All right, here we go.
Whatever you
Here
gotta
we
do.
go. Wow.
There we go. That was a good one.
I don't think that's moved in a long.
That was a good pop. That seemed like it was adjusted properly rather than me smashing it.
Oh my goodness, how much softer now it is. I mean, just.
Yeah, I feel it. It's like.
Whee!
Have you seen one that before?
Severe neck, shoulder pain?
Yes, so it's way better now, but at the time I made the appointment,
Yeah.
I could not move to the right.
Turn your neck
It
at all.
was- Yeah, and I see what you do for the people with
Yeah.
the massage. Because the regular chiropractors, joint chiropractic and stuff, they only do the adjustments, they don't do the massage. So
And even-
I see the spots you're hitting, and that's exactly where.
It's
I'm
hard to,
feeling the
as a patient, it might be hard to tell where they adjust to. You know, the lower neck is so commonly the most injured area. And so if the joints, for instance, on this side are swollen, you won't be able to compress them, right? And so this part of the neck isn't where we should be utilizing very much anyway. We should be using our upper neck to do most of the work. But if the lower neck is doing all the work, so it's your backup engine doing the work, the
Right.
upper neck is your main engine, it doesn't work. So now you're not left with anybody to actually function with. And so you can't turn your neck at all without, was it just going in the neck or was it going down
It was going
into the shoulder?
It was going downwards into the shoulder too.
So when that happens, we're involving two things. You have the joint in the lower neck that's sprained, so the actual knuckle back here is injured, and then the wire coming out from the side will radiate pain over into the shoulder. So you have the nerve in the lower neck involved and the joint. So there's really two injuries, but it can be a disc injury, but the local pain is most likely the joint that was given. That's why you couldn't turn your neck. The joint is swollen, but usually if the joint's injured, most likely the disc is injured also. The care chiropractically should be focused on exclusively the areas around that aren't injured that take the stress off the injured area.
Okay. And my wife tells me like all of this is really hard.
Yeah.
It's really, really hard.
The muscles will get tight
Yeah, very, very tight.
to protect. Yeah.
Yeah.
So if you turn your neck to the right, go ahead and, any pain right now when you turn right?
Just a little bit.
A little bit on the right.
Yeah, on the right.
Okay, and then turn your head left for me. Even that way is a little more restricted than the right. Okay. More straightforward. I got you. All right. Shoulder, left shoulder's a little elevated, so that's avoidance of that right side. So when I'm looking at you, you're still in avoidance. So like when these joints get injured, your body will just sort of, heal tilted away from it. Now what'll end up happening is if you stay in this kind of alignment for too long, the other side will start to get injured because we're throwing the weight away from the right side and onto the left. Any pain in your lower back, anything else?
Yes, prior to this, I had the tightness.
Okay.
The lumbar. I had that. It was really, really bad.
Right in the small of your back down here?
Yeah, it was more on the right side though.
Okay.
Yeah.
And if you tilt your body to the right or tilt left, does it hurt?
Right now, no.
Nothing. But you think in the past it has hurt
It was really bad. It
just
was
moving
tight.
around?
Yeah.
All right. And did it go down?
What triggered it most of the time is when I'm brushing and I
Right.
I
Spinning?
then I felt,
You felt
the tightness there.
Did anything go down the leg or it just stayed there?
So I was playing soccer with my kid and I fell and I had this numbness and tingling to the left side for a while.
Down all the way to the foot?
Down all the way.
How long?
Just
and so
never felt the same.
how many years ago did that start, you think?
That's about a year ago.
Okay.
Yeah, but now it's mostly resolved, say 90%.
So both of those injuries, when we have the local pain again is the joint, and then we have disc symptoms. So we have the discs starting to bulge out, and that's where we get an MRI, magnetic resonance imaging. X-ray won't show it, and this is where, if you take an X-ray, you might see the spaces looking good because the discs will actually swell before they rupture out. And so a lot of patients sometimes can be led down a wrong path because, oh, your X-ray looks good. It's like, well,
Right.
no, he's 40 years old. Your X-ray is actually a swollen disc, and before it ruptures out completely, then maybe 55, the space is all narrowed. But you have to see an MRI to really you know,
Right. And
to
of
know
course,
what's going on.
Yeah, they did an X-ray
And you're gonna
found
miss
nothing. Yeah.
Well, there you go. Another silly treatment protocol for a young person like this, where you have, I mean, until you're 60, where then it's obvious the discs dry out, and then you have the height loss. But at 40 years old, the discs are going to be swollen, they're more fleshy, and so we want to, if you're going to do any imaging, it should be only MRIs. X-rays would be silly for this, and so we want to, again, do two things. Loosen up the areas around, so you'll see me working on the joint below, the joints above, and then at the end of the visit, we're going to try to see how well we can do about bringing that curve back to your lumbar. Your back should have a sway in it. You understand? When we lose that curve, all the weight goes down to the lower back like a ladder, and then your middle back needs to be soft, right? If your middle back is real stiff, right? See, there's no bending happening where your hand is,
Right.
All the bending is happening at the bottom, and so we have essentially grind this area because this is all stiff, and if I bend with my middle back tight, you're going to bend too much with your lower back. All right, bend both the knees for me. We're going to move some stress away from that lower back. I'm going to help you a little. Sit up for me. Take a deep breath in. Try to let all the air out. Exhale. Good. Deep breath in. I got you. Moving. Head back. Let it go. I got you. Relax your chest. Good. Deep breath in. One more. Exhale. Yeah, way too tight right there. Okay. I got you. Let's go on your side. All the way on your side. I got you. Breathe. Let's see if I can put this. There we go. Breathe for me. I'm not going to fall, I promise. Take a deep breath. I'm not going to fall off the table, I promise. Exhale. Wow, really tight. Yeah. So, okay. There you go. There you go. Uh-huh. Breathe. Exhale. All right. All right. Other side for me. It's tight. We'll get it. I don't want you bending too much here. That's why when I'm adjusting you, my hand is up here and down here to try to not let you bend where you've already been bending.
Okay.
Like a piece of paper, if you keep folding it back and forth, it starts to tear. We have to create a new point to bend in. It's like a tooth. You're always chewing on the same areas, and we have to unlock the parts that you're not chewing on. Breathe. I got you. It's okay. Exhale. Breathe. All right, good, very good, okay, very good. We're on your back for me. A little bit of right atlas, yeah. Okay. B.J. Palmer is the first chiropractor's son, and he spent the last 30 years of his life pretty much talking and writing exclusively about the importance and necessity of this upper neck in functioning to ensure that the lower neck doesn't get destroyed. And the understanding that the curves, the loss of cervical curve is what does it, wasn't completely understood until the 90s. 30, 40 years ago, they started to understand that our lives being inundated with looking down and loss of curve create the environment where the upper neck gets tight, the lower neck gets overstressed, to the point where almost all medical surgery exclusively happens right where you were pointing on that right side on the lower. When you overstress a joint, it will grow. In the same way, if you overwork your muscles, they grow, and if you overwork your skin, you get a callus. The muscles, joints, and skin get larger when we overstress them. When your muscles grow, no one calls it a disease, and no one calls a callus on your skin a disease, but if a joint grows, in America we call that degenerative joint disease. It's not a disease process for a joint to get bigger. It's the same thing as a muscle getting bigger. And if you call a joint getting bigger a disease, you have to call a muscle getting bigger a disease, or calluses on your skin diseases. Do you follow me? They're all adaptations to stress. Here we go. I got you. Doing good. There you go. Just this top guy a little bit. Very nice. There you go. All right? Okay. If you have to cry, go ahead. I'm just teasing. That was amazing. It was the best adjustment ever, Ed. So notice this side was a lot tighter. Do you remember when I adjusted your neck? The right side kind of stuck its tongue at me. The left side was like, okay, sure. This knot right here is at the core of what happened.
Okay, so there's a knot right there?
Yes, sir. Yeah, right here is the problem. It represents a lack of mechanical participation and function. This area is restricted. They found very quickly when a joint doesn't move, it starts to become stiff. and just life and posture injuries, whatever, puts this in an environment where this joint got tight. It can happen as quickly as something like 10 days. Yeah, wow.
Trust me, it's soft.
Five!
It used to be really, really hard.
I got a strong thumb, but jeez. That is,
I don't even feel what you're doing right now.
yeah, that is a boulder in there. All right, I'll get it with my elbow.
Like I've pretty much been to
I got you.
hundreds of massage places.
I got you. Oh.
I just don't feel a thing.
There it is. Go. All right, okay. They're just knuckles. They're designed to bend. I'm not asking them to do something outside of what they're mechanically supposed to be able to do. Right? It's not like I'm asking you to spin your head around. I'm just asking these joints to function in a normal capacity. They're underworking. This joint is way too tight up here. And so for every underworking joint, there has to be an overworking joint that compensates. Wow, he's powerful.
I have a very high pain tolerance.
Perfect. There, a little movement there.
Fall asleep on you.
Go ahead. You can do that. I'm not working hard enough. If you want the core injury, it's right there. That's
I feel it.
Yes, sir.
Are you feeling it for real?
Mhm.
Like, is it deep enough? You want to-
I feel it. I feel it. I have literally begged my friends and family to do what you just did, but everybody runs away.
And I ran so far away. Good old flock of seagulls. I just ran. I think it's in the Batman vs. Superman movie when the building's crashing down. You see that movie? And Bruce Wayne is running towards the building that's falling, right? Everybody else is running away, right? And Bruce Wayne's like running towards the building. That's... I'm running towards this knot. Yeah, get it. There we go. Oh, it's getting smaller. It's,
Yeah, like it's I
Yeah.
don't feel it.
Yeah. It's getting there. You gotta stop feeding it. You're tilting your head left way too much. That's what's feeding it. So if you put your bag or backpack, that need if you gotta stop putting it on your left shoulder. If you put that on your left shoulder, do you see how you hike the shoulder? And that tilts you away from this. So you want to put that actually on your right shoulder, or not have it. You shouldn't have any shoulder. My point is that if you're going to have it on something, it would only be, does that make sense, on your right side, so that it actually would close this side and not tilt your head away from it. Yeah, that's good. There we go. Perfect. Let me see that. Let's see if we can adjust it. Let's try to open this up a little bit. There we go. All right. I got you, but relax your shoulder down. I got you. Now relax your head. I'm waiting. You're fine. There we go. I'm waiting. Let this side go. There it is. Yeah. That bone has not moved in a while. When my butt comes off the chair, I'm working way too hard. Do you see how much higher this is here? How much tighter? From here to here is huge knot. This is much lower. Nice and soft. This is why it went down the right leg. You see? The right. This is why you sprain this side, because this is tight here, and you sprain the right lower. But the reason why you're spraining the right lower is because you have an injury on this left side. That's probably why you had it down the left leg, and then you're now avoiding the left side, and now we're abusing the right side in what we call compensation. But the oldest injury is right there. My dad has taught me since a teenager to target the stiffest area, right? Because if you can unlock the stiffest area, you give the most relief to the abused area. And your stiffest part, and I hope when you get back home, if people can't see this thing right here, we're in trouble. It is painfully obvious that this is the tightest part of your back, right there.
Yeah, I feel it.
That knot, probably been here since you were a teenager or younger. That's your problem. Okay. All right, I'm gonna get you feeling something here. Yeah, that is way too tight. Right there, it's painfully obvious. They gotta be able to find that.
This is new to me.
Yeah, I
So I
understand.
always got the issue with the neck.
Yes, sir. Well, the neck creates this, or at the very least puts this in a position where it's more easily injured. And so, yes, the neck is the ultimate problem, and then it creates domino problems, but that doesn't take away from the fact that this is the most direct cause of your lower back symptom. Indirectly, yes, the forward head posture, the knot on the right upper part of your neck creates this, but this needs to be untangled. B.J. Palmer would have taught just work on this, and this would go away. And I'm not completely disagreeing with him, but I believe that to expedite this and to get this done in a much faster way, you need to work on this knot. You'll hear it, upper cervical chiropractors, where they're going to be kind of solely focused on the atlas, and I get what they're getting at, but we can't ignore the rest of the spine. I mean, yeah, wow. Come on. The only thing I can say is don't ask for more, okay? Because I'm just going to give you everything. And if you ask more, I go, that's all I got, but I gave you all.
I think I feel it easing up though.
Yes, yes.
Oh, good. That's good.
No, I will come back to it, but do you bring it?
So you're feeling this massage, right?
I mean, yeah, a lot smoother over here.
Right there.
Mm-hmm.
Is that a knot?
Yeah, these are the roots of your neck, but it's also part of that injury on the left side.
Yeah, I feel it.
somebody wants you, Carl.
Split there, babe.
Okay. Yeah.
Oh, never guessed.
Yeah, nobody showed you that scar right there.
No, not ever.
Everywhere else nice and smooth. And right there, very big scar. I mean, what a difference. I mean, you can see it just feels soft here, right? Soft. And that lump here on this left side. Yeah, you got to put a back brace on. When you're doing any type of lifting of a patient, you gotta have a back brace, and you just put it on like a Velcro brace over your lower back to bind up and protect your lower back when you're lifting patients. You can't be doing that without some sort of back support. And then you unvelcro it once you're done lifting. But when you're doing any type of lifting type bending forward and lifting maneuver, it's gonna catch up to you.
Yeah, I did a lot of heavy lifting.
Right. So this is the joint below. This is what I adjusted when you were on your side.
Mm-hmm.
This joint ends up quitting when we sit for too much, and that again puts all the stress on your lower back, lumbar 4 and 5. So keeping this joint in the team, on the team is imperative. Jackhammer, chiseling away.
Feels great.
Cool.
Feels really good.
Did you feel the massage?
Yes, I did. I did. I did.
Just wanted to work this guy a little better. Use gravity to my favor here and work this. Right there, yeah. It's softening up pretty good. Yeah, time to move to Florida. Time to move to Florida. There's no bottle of Dr. Red I can give you. Yeah, that's the problem. Ed, get out here and work on my shoulder. Work on my neck. Good, thanks. Okay. Go ahead and tilt your head left for me. Tilt left. Go.
Ooh.
Go ahead and tilt left.
Never had that one before.
All right. Go ahead and tilt right. Up, okay. Okay, tilt to the right. Up and on that side, okay. And then it's like 20 minutes. Your neck needs to bend over this, so we have to first unlock your spine to make this, possible and to make it effective. What happens is if you put people on this and their neck is stiff, it doesn't do
work.
anything.
Okay.
It doesn't work. So this has to be used in conjunction with care.
Okay.
Yeah, your neck, all the bending wants to happen in your lower neck, and I'm asking your upper neck to bend, and it's, really resistant in the upper neck. And 20 minutes, this keeps your upper neck functioning for longer, right? It's like a retainer that an orthodontist gives to keep your teeth from going back to crooked. So with chiropractic care, we use this to restore the curves in your neck and then to maintain them. And then
This has to be done on the floor, yes.
Correct.
Not in bed, right?
in bed, you'd be
Soft,
easier.
squishy.
You could, but it's just less benefit. Ultimately, we need to be able to do this 20 minutes on the floor and it'd be easy.
Okay.
And then to get off, you roll to your side. So roll to your side. There you go, roll all the way to your side. Use your right hand behind you to move it out of the way. If you can push it out of the way, push that out of the way. There you go, and then lay back on your back. That make sense?
Okay.
That's how you get off that. And then after you do that for 20 minutes, give yourself a few minutes before you get up. Let your body reacclimate, adjust,
Okay.
to show off a little bit.
It feels
Yeah.
decompressed.
Oh, it's gonna change your life.
Yeah.
This
it
is-
does. It really does.
This is my portable thumb. So you asked me, this is called the Denneroll pillow. You can purchase these online. You don't have to be a doctor to buy these. Like this device you can't buy online, but this you can go on the website and buy a Denneroll pillow.
Okay.
We need to be on our back sleeping. If we're not sleeping on our back, it's because many times there's monsters in our back that we go to our side to get away from. So my instruction is let's get the spine clean so you don't feel the desire to run away from the problems in our back. This is the Denneroll pillow. It has a mini version of the neck guy in the pillow. And then there's a little hole here that you can open up and then head back and let your head sort of sink into that hole, and you can stretch on the pillow. If you want to stretch a little bit, you open up that little flap and then you can stretch, and then if you want to go to sleep and not stretch so deeply, you kind of just lift the flap up, and then it reduces the depth. All right, you doing good?
Really good.
Nice to meet you.
Really good.
All right, thanks for getting here.
Thank you so much.
Awesome,
It's
you did
been
great. Awesome, appreciate it, thank you.
Well worth it.
One, I went to the gym. I did a lateral raise, but not this way, like this.
Okay.
I heard a
Okay,
audible, clear. I ignored it for years. Well, I didn't ignore it. I couldn't get treatment from my doctors or from my chiropractor.
just a click, no pain.
Pain.
Pain where?
Right here. Right here.
Okay,
And then
right lower part of your neck here, yeah.
T1, C7.
Yep.
And then about 5 years later, after college and stuff, I had some money, so I started seeing a lot more doctors and therapists. I found out I paid for a lot of MRIs. I had a herniation between 6 and 7,
Yes, sir.
and a bulge between 5 and 6 on the right side.
Yes, sir.
So I assumed that this movement was the problem, but the whole time I was in school, I had I think I developed a really bad posture issue.
Yeah.
And I think it amplified the entire
Yes, sir.
thing.
Yeah.
So right now, like I've been dealing with this for a very long time. I've spent a lot of money. I've seen many, many therapists of every kind that you could imagine.
Mm-hmm.
My hips and my pelvis are extremely tight on this side. I have some numbness here.
Okay.
My access on the right side here,
Okay.
frozen like a piece of concrete.
Mm-hmm.
And locking mobility in the C7, this is where the pain always is,
Yes,
is
sir.
here.
Yep.
So it's blocking mobility in this joint here, as well as I think that this pain is from my shoulder being out. Because I got my pec minor and the teres is so tight that it's crazy.
Okay.
So I don't know what the problem is, but I messed up from head to toe on the right side.
When we have nerve pressure, your shoulder will misalign to try to find relief. So of course the shoulder's out of alignment. When you're pinching here, when you have a disc that's hitting the nerve in your lower neck, your body will try to round your shoulder forward to open up this channel.
Yeah.
That's not, this of course is going to be contracted, and there's going to be issues in the shoulder because of that misalignment, but it's ultimately happening because you already know, a disc injury.
Yeah.
The frozen atlas is the cause. And so you've maybe been already shown that a little bit, that the upper neck, or maybe I
I've
didn't
just been
explain that.
researching. I'm like a
You
YouTube
could-
chiro
but-
for
but-
dummies. That's what I am.
You've got it. You've got the
No.
answer. You've already just told me. He gave his own diagnosis. The frozen upper neck is like a rock. That is the problem. So the neck is designed to work primarily in your upper neck first. About 60% here works first. When you turn your neck, 45 to 45, the only bone that should move is your upper cervical. And so how did you wear out your lower neck without first wearing out your upper neck? Well, it doesn't move. The loss of curve in your neck, all the weight like a ladder went down to your lower neck, and so the discs, the cartilage in your lower neck was aging too quickly, and then the straw that broke the camel's back was the strenuous lifting of something that finally, knocked it over the edge, and that's when you finally felt symptom, kind of like a cavity in a tooth. You finally chewed on something hard, and then the tooth cracked.
So
Right?
you think I was tight posturally before?
100%. No. Yeah,
That makes sense.
you have to have healthy discs don't rupture. We know this with research. It takes 10 years minimum to even get a disc to herniate. So what happened at 21, we have to go back to 11. You understand? For
I
an
had bad
injury.
posture since I was a kid.
Right.
I
So
see.
the
Okay.
injury, or even more, even just posture accelerates if there had to be a trauma. There had to be a whiplash, or a fall out of a tree, or a fall off a skateboard, or fall off a bike. Something happened at 10 that then allowed 21 to have the injury. They took healthy discs out of cadavers and they subjected them to thousands of pounds of force. They don't herniate. You have to have a weakening of the tissue first. The point is that the upper neck must have been stiff for quite a period of time that allowed you to overstress your lower neck. And I would imagine,
It's possible because I cracked my neck my whole life as a kid.
and that's accelerating this. See, when you pop your own neck, unfortunately, we mainly only pop the ones that are loose. So you keep on making what's loose looser, and what's stiff doesn't get any looser. So the disparity between the two gets larger. The goal of an adjustment is to only work on what's tight and to leave alone the lower neck. Nobody should be touching your lower neck. And can only imagine that most chiropractors and most therapists here in America, they almost always want to work on where it's injured. And that kind of care only further aggravates the wound because it's not injured because it's not working. It's injured because it's overworking.
So when I force mobilization, you think that's bad? Because usually the only relief I have is forced mobilization.
Explain what that means to you.
Like, because my neck doesn't move,
Yeah.
so like I have like towels and bands and stuff.
Right.
I'll literally position my neck and I'll focus on the vertebrae that I want to move.
Right.
And I'll mentally like try to move it and then
Gotcha.
I get relief for 2 seconds and then I
Right.
wake up, I'm in pain again.
Correct. Yeah, there's an aspect of a nerve where when we stimulate the mechanical receptors, you inhibit the pain receptors. That's what you're tapping into. So you're popping your lower neck. There's a loop goes in your spinal cord back out that makes it feel better to pop the joint. But you're not fixing the mechanical imbalance, the postural imbalance that's perpetually putting stress on your lower neck. Today's care today, I'm going to work exclusively on your upper neck and then aim your neck back into that curved position that it so desperately needs to be in. The more forward your head goes, the more torque that the lower neck is under. So it's not just about getting the curve in your neck. We also have to reduce some of the upper back rounding forward.
Because I think my shoulder blade and everything here, honestly, is
100%.
so messed up.
100%. So the nerve that comes out of your lower neck goes to your shoulder. So the health of your shoulder is going to deteriorate. The muscles, the skin, the ligaments, the joints, those are all a domino effect of having that disc injury in your lower neck. Most people come in here thinking it's their shoulder. You already know I have a disc injury. And that's what I usually try to tell people when we have MRIs. We're already there. So we're treating a lower neck disc injury, but the point is that you have other parts of your neck, other parts of your spine that are not injured. And that's why I actually want to, 80% of your spine isn't injured. And that's what I usually see with MRI. Most of people's spines have no injury while...
I've had MRIs from head to toe everywhere, on my shoulder as well, and they didn't find anything.
Correct. I understand. Most of your spine is not injured. My point is that the reason why it's not injured is it's not working. Yeah, so we're dealing with your head's about 2 inches forward. We have to get the ear. Your ear hole belongs over the center of your shoulder, sort of that little seam here on his shirt. That's where the ear hole should line up from. And so the more forward your head goes, the head weighs double every inch. So if your head weighs about 10 pounds, the muscles do double the work for every inch the head goes forward. So essentially your muscles feel like they're holding a 40-pound, 80-pound head with it this far forward. That's going to create a constant
Pull.
inflammation, stress, and then exactly antalgia, avoidance.
Okay.
Ultimately, now when your head goes forward, the hole the nerve goes through gets bigger, so that because there's a disc hitting the nerve, the forward head posture was an avoidance. Your body did it intelligently and purposefully to alleviate that stress, that you're constantly feeling the need to pop yourself. The goal with the adjustment is by getting your upper neck moving, you won't feel the inflammation in your lower neck, you won't feel the desire to pop your own neck, and ultimately you won't even be able to. You shouldn't feel, your neck shouldn't pop in the lower neck because your whole neck moves as a team. Take a deep breath in for me. Head back for me. Exhale. Let it all go. I got you, bud. All right, deep breath in. I got you. Let it all go. Let it go. I got you. Deep breath in. Beautiful. One. Exhale. All right, stop it. All right, so the cage, the thoracic cage, is the primary cause for why the lower neck overstresses. So we have this cage in our chest that immobilizes and protects our organs. The area right adjacent to the cage, C7, the last cervical vertebrae, is prone to overmobility because the cage is protecting our chest, right? So the lower segments I got to move. That last guy I adjusted there at the upper back, totally frozen. And that is a large part of why your lower neck is injured, is because you're frozen
Yes.
right here. So the guy next door to your C7 is shut down. And we got to get him moving.
That's what I'm feeling. You want me to flatten out?
You're fine. Whatever's comfortable. Whatever you can. Want you to be able to relax. There you go, bud. You're doing good. There you go. Big bump here on the right side.
Yeah. It's bad.
All right, it's okay. We get it fixed up. All right, I got you. I got your head. Lift your chin up for me a little bit, and then now relax your neck. Perfect. You got it, bud. Right there. There you go. Okay. How'd that feel? You all right?
That was good.
Yeah.
I think we need a mirror on the other side. Eh?
Yes, sir. That's where we're going. Yep. We are purposefully trying to not adjust your lower neck. The upper neck, nobody should be contacting and thrusting into your lower neck.
So I should stop doing that.
You're injuring
Okay.
yourself more.
All right.
You're picking at a scab. The best analogy is having a cut on your skin, and we
Okay.
keep on. I understand your desire, because when you release the air bubbles from the joint capsule, it makes it feel better. There's
That's it.
pressure in the joint from the inflammation. Air bubbles are occupying the space. You release the air bubbles diffuse back in. If the pressure comes back, you're just back where we were, square one. But in the process of continually popping those air bubbles out,
You're wearing it out.
you're wearing out the disc more, but you're also inflaming the joint more, which then makes it swell more, and it creates a positive feedback loop, downward spiral, where we're going to lose. I got you. Now relax. I got you. Okay, easy. I got you. Relax here. Yeah. Okay, we'll get it. So the left upper part of your neck is the most responsible for the right lower. So when the left upper part of your neck doesn't work, the right side will overwork as a result of the left side not working, and especially the right lower will compensate the most. So the ultimate cause of why we wore out the right lower part of your spine, the right lower C7 disc, is ultimately because of the atlas on the left side. So this guy up here being tight,
But now
it correlates.
Now it's tight on the right side, no?
Well, when I adjust your neck, when I turn your head right, we're adjusting the left side joints. I know it's confusing.
Okay,
Yeah.
got you.
Yeah.
Yeah.
When your head is turning right, I'm asking the left joint to compress over here. The joints on the right side of your neck did what I asked them to do. The left side pretty much stuck its tongue in me.
Yeah, that makes sense. Oof. Yeah, that's clumpy.
Right, you got it.
Oof.
you got injured right here.
Nobody's ever done that before. That's pretty chunky in there.
We have to start. Your head won't tilt left. Is the simplest way for me to put it to you? Is that you have a favoritism
That makes
to
sense.
tilting
'Cause
your head right.
I'm stuck here. Yes.
Correct. You're stuck to the right, and that's why you're pinching the right. There's an injury right there. Feel a little.
Yeah, I can.
Yep.
Something's chunky
Something's
in there.
crunkling,
It feels weird.
crunching around. Yep. We'll get it untangled. This is where you need to have guide people up when you're up in Canada, back where you get back home.
That's why I was
Focus right
happy
here.
about the video because I was like, oh, maybe
Yep.
I can show some of them that.
Yeah, left upper part of his neck. This is, you'll feel this little, and then try to tilt him to the left. You stop sleeping on your right side. You got to get off that right side.
No more sleeping on the right side.
I would just take a big, or at the very least, try to avoid sleeping on the right. That's feeding the problem. You're feeding the cervical misalignment.
Okay.
So tilting, all right, tilting your head to the right or lifting your right arm up is the same thing. You're saying this is the same as this. So because your head's stuck to the right, you're saying when you're lifting your arm up, that was the same as you tilting your head to the right. So
I can't lift my arm up correctly on
correct.
the right side.
You won't because it's pinching. You're pinching the right because your head won't.
I see.
It's way off to the right, and there's no room for the nerve to go through. There we go. Right there.
I always cracked my neck as a kid.
I got you. Yep, this is a case of why I tell kids coming here all the time that if they get adjusted and they get their right posture, they won't feel the desire to, and they won't be able to. You shouldn't feel the need to do that. It's basically you had inflammation in your neck that you were desiring to release,
Mhm.
but by doing what you can do on your own, you end up just further stressing the area, getting temporary relief. Very common. You're not alone here. It's okay.
Have you had cupping or guasha done?
I've had cupping done
No guasha.
so many times that I can't count. I had the scraping
Okay.
done one time, but the guy was kind of afraid to go hard.
Okay.
He was kind of like
You gotta-
pussyfooting around a
there's
little
already
bit.
there's already a mark coming out right here. This is where you.
I'm pretty sure if you hit my back and my scap,
Uh-huh.
my hips,
We'll
you're
get-
going to turn me purple like Barney for sure.
It's already it's already purple right here, but it's already right
Yeah, I
there
can
on the-
feel something in there. It's like lumpy, dude.
There it is.
There's like a golf ball in there.
Yep. Yep. Yeah. Okay. Nerve pressure is just awful.
It's frustrating to a therapist after therapist for years. Right?
Well, exactly what you're saying, therapist. Therapy is care focused on pain relief, not correction. Yeah, be careful with traction. I use a little bit of traction just to unlock things, but especially before 55 years old, the discs are all very fleshy, and so prolonged traction, to me, almost like gapes the wound. If you have a cut on your skin, it'd be a bad idea to sit there and pull it open, right? So think of the disc in your lower neck like a piece of fabric that has a cut in it. We don't want to be pulling on it. So what should we be doing? We should be aiming your neck back to the curve. Your neck belongs arched. We call this extension traction, and we'll introduce the Denneroll. There's a piece of foam that emulates my thumb, which I'm doing right to you right now on your neck. It just emulates this position. We're adjusted insofar as you can stretch and every day work on your cervical Denneroll. And the Denneroll essentially becomes your chiropractor. You go to chiropractors to make the effectiveness of the Denneroll work well, essentially. But once you're able to lay on the device, it's stretching that made you lose the alignment, it's stretching that restores it. So we can't stretch effectively if our neck is stiff. If the upper neck is all rigid, then it's highly likely that your upper neck won't stretch and your lower neck just stretches, does all the bending, and therefore you get hurt, right? Because you're just further moving the areas that are already moving, the areas that you've been self-popping. So sometimes a couple visits to effectively get your upper neck moving, and then your care becomes mostly at home. First goal is 20-minute stretches on this piece of foam, which I'll show you.
Okay.
And that becomes your doctor. And I kind of want that under your belt, and that's when we kind of reevaluate, get 20-minute stretches. You kind of have your middle upper neck. You'll try to contact as high as you can. You'll take your hand, you'll place it on your forehead, and you push. I know, yeah. And you've got to get this arch. Just real sore in the upper neck here, you okay?
That's so tight. It's
Yep.
crazy, man.
Yep, that's the problem.
Yeah.
That's what, and you can, you can brush your teeth at home essentially with this Denneroll. You're going to be targeting this upper neck using this piece of foam to.
So this curve that you're creating, this is the natural curve that I should aim for, and
This is the natural curve you had when you
the
were 6.
traction that I'm shooting for all the time is no bueno. It's a
Taking
bad idea.
bad, taking you straight.
Because I feel like I need a hook
I
in
know.
my foot and a hook in the top of my head, and two people go.
Well,
That's how I feel
All right,
all the time.
I understand. The trap is this. I totally get why you wanted to have it. When you're doing that, you're taking weight off the joint and you're opening the hole the nerve goes through. The problem is you don't live that
And
way.
it's not sitting correctly, so it's just a temporary.
And then when you get off of it, you're worse. Do you understand? I get
I
your
see what-
desire.
I see what you're saying.
But you're setting yourself up, unless you plan on living, like in Back to the Future Part 2, where the dad's floating around the kitchen upside down, unless you want to live inverted, it isn't a good plan.
Okay.
Because you live upright. And so the only way to be comfortable upright is to have the curve in your neck, the same curve you had when you were 6 months old, that we lost because nobody told us to value it.
But in order for that curve to be maintained, the lumbar curve needs to sit correctly as well.
Well, the thoracic curve has gotten too big. When I looked at you from the side,
But it's a compensation from one to the other.
they happen together, so we call it coupled motion. Not only is your neck and your curve straight, but it's gone into a hump in your upper back, which has then subsequently made you lose the curve in your lower back too.
Got you.
So they all are connected. So in order to induce curve in your neck and lower back, we have to reduce the excessive curve that you have in your chest, which is why I hugged you earlier. Because I'm trying to get that in, which we're going to work on in a second when we go face down. And we are going to do stretching on your thoracic cage also to not only loosen it, but also to reduce the hyperkyphosis, we call it,
Yeah.
the extra curve that you have in your chest that is leading to your loss of curve in your neck and lower back. Okay. It's okay. Relax right here. Let it go. That's okay. I got you. Good. Yeah, we gotta work on digging on that. You gotta help target that left upper neck. It's just filled with fluid. I got as much air out of it as I can. It's gotta be squeezed. It's like it's like a swollen. If you punch a wall with your hand, your knuckles get all swollen. It's all swollen on the left side, and that's what it feels like, a water balloon.
Don't be afraid to go hard. Man.
All right, here we
Whatever
go.
you
Here
gotta
we
do.
go. You gotta really compress that out of there. That's brutal, I know.
Hey.
Exhale. Relax your back, relax your back, relax your chest. It's okay. Yeah. It's okay, other side from me, other side. Okay. Exhale. Alright, so face down for me, shirt off. Yeah, it's just so elevated. Your thoracic cage has gotten too large, especially on your left side. Right here, it's just frozen. You are jammed, locked tight up here.
The analogy my other guy uses is it should be like rubber gauge, but you're an iron rod.
Should be like Gumby, yeah. Should be absolutely supple. There's no normal stiffness in your back. It's all posture and injury. Right there, bud. This is
Yeah, that's where it's marked.
Yeah. All right, take a break.
So what, foam roller on the left side every day? That's
Well,
what I should be doing?
That's step one. There are deeper steps. I mean, yes, you want a 20 minutes is the minimum it takes to change posture. It's not to say 5 minutes is not effective, but it's only insofar as it guides you to 20 minutes. You have to counter stretch for about 20 minutes for the ligaments on the front to start stretching. So your posture is a distillation of how tight these ligaments are. And if the ligaments on the front are tight, then even if we contract the backside, that tight ligament will just pull you back forward. We have to go deep enough to stretch that ligament. So these joints have to come together in order to get deep enough.
Okay.
And so if these joints won't overlap, we can't even effectively stretch the front part of our body. There's joints in here. You gotta get those unlocked. These are knuckles right in there. It's okay.
This is me trying to be quiet, man.
Okay, you're doing good. You're doing good. Just gonna hold, breathe. Mm-hmm. So for everybody wondering, this is the tight area right below his injured area. This is the cause. It's not injured in of itself. We took MRI. There's no disc injury in here. But this area not functioning, which is evident by me pushing on it, and Ed, it doesn't want to bend. If it was bending, there'd be no discomfort to me pushing on it. It'd just be easy. There's a resistance in here, and that is his problem. The area right below the injured area is the cause. Right here is the cause. Okay.
Jesus, man. Is this going to be the worst part, or is it going to get worse?
No, we got some worse parts down here in a second.
Okay.
You have to get this upper back beat up. Somebody's got to dig up here.
How many times do you think I got to come here before I'm normal? Is it possible to be normal,
usually-
or is this just a pipe
No,
dream?
100% no, I change everybody here. It takes me a handful of visits to get this loose.
Take 5-6 times?
Something like that, yeah, to get this area moving for you. So that it doesn't hurt so much. Now, I'm not saying it'll be perfect, but it'll be like, Ed, it was a 10, now it's a 4. You have a frozen upper back, and your poor lower neck is the only part of your neck that actually works, or spine that only works. This is all jacked up and stiff in here.
So my back's a rock, and the neck is compensating, and
But there's no reason.
it's overworked.
There's no surgery in your back, right? Everything God
No.
gave you is in here, right? So there's no reason we can't restore it, okay? You got to guide practitioners, leave that lower neck alone, upper neck, upper back,
Okay.
and then we have to start putting the curve back in your spine and not just pulling it straight, and stop self-popping your spine.
All right.
You know, it's tough. I know it's tough. I understand your desire. I'm not blaming you at all, okay? I'm not blaming you one bit. I understand, Ed, I'm hurting, I'm suffering. It gives me a little bit of relief for a little bit of a period of time. That's why I do it. I'm not blaming you, but we're going to lose. And the bone spurs are going to grow, and then we're going to run into those. And it just gets more and more difficult.
Well, hopefully we can loosen it up.
Yep.
And I'll come back down to Sarasota.
We'll get you started. The right side of your neck is hypermobile. This is locked over here. The whole left side of your chest is really locked, and then the right side is abused.
But I mean here.
Correct. Yes, sir. That's
Okay.
because that's an extension of this.
Okay. Okay.
See, I know when I speak of your right lower neck, that this and this are the same thing.
okay.
These two things are the same thing to me.
Got you.
The right lower neck is your shoulder, and the health of your right shoulder is going to be the worst area because that's what this controls. That's what this guy right here controls is your right shoulder.
You don't think I need some Guasha, Geisha in my
We will.
in my pec or
We will.
my
Yeah,
terrace
we'll take it
area?
out. Yeah, for sure. But it ultimately won't. If you,
'Cause-
that independent won't do anything.
Because I get crepitus in those areas
Understand?
when I move it. That's the only reason I mentioned
because
it.
it's misaligned. Remember
Okay.
I told you earlier
Okay.
that the shoulder went forward to alleviate the disc injury here?
Yeah.
So you already
Yeah.
know the disc injury here will cause this to go forward to open this up. And then because your shoulder's forward, now you have all this crepitus. But that can only get alleviated by getting this to calm down, the shoulder comes back, the crepitus goes away. This will only calm down by getting your left upper neck working and your upper back working.
So what is it? It's like the same thing as cupping, basically. It's an inflammation response.
It draws blood into the areas that are frozen, and anything that's trapped in there that's acidic will make a mark. So when there's lactic acid in high amounts because of guarding or posture, that lactic acid, which is essentially cellular exhaust, it's the waste material that your cells produce when they burn energy to make energy, essentially. And so because an area is tight, because it's got poor circulation, because it's being guarded, the lactic acid can't get out. It irritates nerves, causes soreness and pain. And by working on the area, mobilizing it, pushing blood in there, we bring oxygen, it binds to it, converts it to carbon dioxide and water.
Heals itself.
It allows the tissue to repair itself. You got it.
Okay.
Yep. Your SI joints were locked completely. I mean, about as locked as can be. This is going to leave your lower back.
So what's the SI?
So it's
Where the lumbar touches the pelvis?
It's where the sacroiliac joint, called between the sacrum, so below your lumbar is your sacrum, and then that attaches to your ilium, or your hip bone, if you want to call it
Yeah.
that. So there's a joint here, largest joint in your body, about 4 inches long. That's what I was checking when I put you on your side. I was checking to see how loose this joint right here is, and it pretty much flipped me off. It said, nope. And this joint not moving is going to put too much stress on your lower back. The lower back stress is going to cause hip, hamstring, leg, numbness, all that stuff down the leg.
I got it on the right side, yeah.
You're saying that happens because this joint here is locked, along with the middle back locked. So again, above and below the lower back are the causes for why the lower back is in distress, the pinching of the nerves, inflammation, the soreness. But this, you need to have somebody dig in here. You got to loosen up this joint. Right, that's the top of the joint right there.
Oh, God. It's worse on the right side.
Mm-hmm.
Oh, yeah. Happy thoughts. So this is gonna,
Take stress off the lower back.
it's gonna mess up my hip rotation for athletics as well, though. This problem that you're working on now, because I noticed my hips don't rotate well.
Correct, yeah. I can't imagine you do well in any type of
Anything that I
running.
need to rotate my hips, it's not good.
I bet it's very poor.
Yeah,
Correct. This
it's-
joint is frozen. Yeah. Sitting locks it, injuries lock it. You know, you've lost mobility. And what I was finding when I was rotating you is all the mobility was happening here, and that's why I kind of didn't push so hard, because there's a high chance that that side posture adjustment just pisses this off, right? Because this is so locked.
It's probably because I've been trying to rotate it, and I'm just rotating the lumbar.
You're popping these guys.
Yeah, exactly.
But these guys are getting stiffer and stiffer, and I was trying to just move, and you got this locked in here, but this is, you know, frozen.
Would you like more water? Are you okay?
I'm cool. Thank you, ma'am.
You're doing really well. I feel really bad. But
You get a lot of this, what you're seeing right now?
Yep. You're doing good, bud.
Well, you just don't cry as much as
No,
me?
everybody. It'll get easier and easier every time we let the blood go in here, let it rinse it out. Every visit it gets easier. This is the hardest it gets. This is the hardest, you know, treatment level. You know, once every visit it gets usually easier and easier. I got you. Keep that forehead to forearm contact for me. Breathe for me, bud. Breathe, and then exhale. We're gonna arch up. Good. Keep exhaling. All right, breathe. It's okay. Breathe. There it is. And two birds, one stone. When we're working on the back roller in a second, I'll show you when we're pushing on your chest, we're gonna have your arms to the side, and we're gonna work all these angles. So at the same time we push the chest in, does that make sense?
Help me bring my chest
We're gonna
down.
bring correct, we're gonna stretch the shoulders back. So that's how we're gonna deal with this, but you shouldn't need to have your pecs rubbed all the time. The goal is to, once your spine is moving, that you can care for this yourself with the stretching.
It makes sense what you're saying, because I've had a lot of deep tissue work done in those areas, and I still have pain.
Correct, it won't. It's temporary at best, because you're not getting to the frame. We gotta get the frame sorted. The tendons are held tight around your shoulder when your shoulder is forward. So then when you move your shoulder, those tendons will rub over the bone and create clicking and popping sounds. But it's the alignment that creates the tension of the cables, guitar strings essentially, that makes the clicking. It's just yeah, of course. It goes back to one of the first things you said. I have a disc injury in my lower neck. There's your problem. Yeah. That's what's creating everything. The whole thing is a domino effect.
The main thing I noticed, Ed, specifically with my shoulder, is because it's the nerve root that runs through the brachial plexus. It's not the dorsal scap or any of those. Those ones are probably messed up too, but it starts with an M, the bicep one. Because I have no bicep control on this side.
Bicep is median nerve.
Yeah. And I started messing with it, and I got a little bit of relief, so I don't know if that ties into something. Like when I flex my arm on that side, it's not solid, it's not strong.
Correct, 100% is your nerve. There's no rubbing your arm that will fix that. We have to get the nerve unpressured in your lower neck. But no, relatively here, I mean, I've worked on a lot of shoulders, people with way worse, looking discolorations on their shoulders. Yours pretty minimal.
Oh yeah?
It's nothing crazy.
I didn't expect that.
It's your neck. I'm not surprised you're feeling it in your shoulder, but it's ultimately your neck that's the...
It actually hurts more on that side.
Correct, you got it. The left's the lock side. I might actually get more of a mark over here.
Yeah, that side hurts. We should do like jiu-jitsu or something. Like strong fingers, dude.
Submit. Right there, yeah, you definitely got something right there.
Yeah.
Right there. Give it a little time there. Let's go back to this guy here. Yeah, that's right there. Right there.
There we go. That was a good one.
I don't think that's moved in a long.
That was a good pop.
Are you okay?
No, I'm cool.
Yeah.
That seemed like it was adjusted properly rather than me smashing it.
Get the idea? How
yes.
tight that left side was?
I,
That's ridiculous.
I hear you, man.
Your neck, oh my goodness, how much softer now it is.
Yeah, I feel it. It's like
Whee! Yeah, that
was overdue.
that's about the limit of my ability, bud.
Have you seen one that before?
Yes, but
Sorry for
usually it's
No, no,
okay.
you're good.
Usually a little bit older people, they have more time to abuse it. Yeah. Yeah, that's got to be easy to turn now.
Yeah.
Do you do jujitsu?
I feel good. I've done a little bit of some training.
Good.
Jesus.
Yeah, there's it's all just crud in here that needs to get
I got beat up.
face down for me. I got you. Okay. Come with me, right over here. Get the idea? So your neck wants to be straight. We will press it into the mold, and Ed, it feels like it comes back out. I know, the more you do it, the more it'll comply and get used to just being curved. There's gonna be a 5, 6, 7, 8 times of doing this before your neck willingly goes.
If I feel it going this way, Ed, should I
You
compensate and force it to go this way?
You can go a little bit. I would give like a 1 month prescription. This is not what the guys that make this advise, but I do a little bit. Yes, I would do a little bit left,
Correct.
right, to get a little bit,
Okay.
to emulate what I was doing on your back, holding my thumb on the left side, because we're trying to decompress the right. We have to get the head tilting left. Again, this would not be a forever prescription. This is just a 1 month. If I don't see you or if I don't reevaluate or somebody like me reevaluates you, I wouldn't keep doing it because it will switch.
I see.
So
I hear you.
it'll overcorrect the other way. Right rotation, you'll have the head pressure on your forehead, and then it's 20 minutes. It's 20 minutes. You have to lay on the floor. The first goal is to do this for 20 times. So if you did 2 a day, it'd be 10 days, right? If you did 3 a day, it'd be 1 week. I want this done 20 minutes. There's no benefit from going farther than 20 minutes. You've reached about 99% benefit after 20 minutes. So go ahead and get off. I'll show you how to get off in a minute, but what you'll do is after 20 minutes, you get off, go do something for 30 minutes, get back on and do it again, right? You want to stretch that rubber band multiple times. You want to take it, hold it, stretch it, then let it contract. Then stretch it again and let it contract. And you have to take it through that cycle of stretching and contracting about 20 times to get it to permanently be lengthened, you understand, and looser. It's like a rubber band. The effectiveness of this is limited if I can't get those joints moving. Do you understand that we finally got today?
Yes.
You understand? Because otherwise I would just get on QVC and sell pieces of foam, right? But they don't work if your neck is all jacked and stiff. It doesn't bend. So then it's just sitting there straight on the device. That makes sense? Not actually curving over it. So, but once your neck is curving and once your neck is supple, keep doing your stretches, what you'll feel is there is going to be a period of time that will go by where the effectiveness and ability for you to stretch on the Denneroll becomes less. You understand? Ed, I don't feel like it's doing much anymore. And that's because your neck is getting stiff. Does that make sense?
Yeah.
And that's when you need to get adjusted again. How long is that? I have no idea. You got to kind of just trial and error and figure out how long you can go wherein your stretching is still good. You're doing great. Yeah. To get off this, don't lift your head off of it. You'll use one hand behind your head to lift your head passively without using your neck muscles. Use your other hand to grab the device, lay your head back down. Especially after you've been on this for 15 or 20 minutes, it's going to feel very odd. The back of the neck will go warm or tingling, might even go numb. It won't do that as your neck becomes used to being curved because there's a huge disparity between where you want to be and where I want you to be. That is the kind of the growing pains. Your shoulder is rounded forward. And as we start stretching it back, it is not going to just love this idea. It's twitching, it's hurting, it's not going to like it. We have to go to the edge and back off. Time is more important than depth. So don't overwhelm yourself. Don't kick your butt so much that you can't move the next day. You understand? You're trying to go to the edge and back off. And as long as you're doing 20 minutes, even if it's at a mild level, we're achieving goals here. We're gonna improve as long as you're getting to 20 minutes. It takes 20 minutes. You can put a camera and videotape yourself on this, and you see very little change happening until about 15 to 20 minutes. Your ligaments on the front finally give, and your body sinks in.
I mean, because I feel in my leg. It's
Yes, sir.
weird.
Yeah, roll back down. Roll back. Roll down. You understand? That's happening because your lower back's bending too much. So that you're going to need to limit how deep you go downwards. When you start feeling that leg happening,
So when I'm arching my thoracic, I want my lumbar to be straight.
we're trying to not make hyperextension. That's why your knees are bent. I don't want you bending too much in your lower back.
Because with my knees bent,
Correct.
will make my pelvis do this.
Correct. It takes some of
Okay.
the extension out of your lower back
Got you.
while we're inducing extension.
So I should keep my
Correct.
legs tucked in my butt when I'm doing it.
Yes, sir.
Okay.
You got it. Just some fun stuff. There we go. Bud.
Oh, and
Yes, sir.
pinky toe on this foot, I broke it last year.
Okay. Okay. How did that happen?
I kicked the guy and he checked the kick.
I got you. I got you. Okay. Okay.
But that probably contributed to my crooked hip.
You're walking differently, right? Yep. Oh yeah. Oh yeah. I got you. I got you.
I feel a little different.
Yeah. Well, there we
Yeah,
go.
see, it came right out.
There you go. Any injury, we want it to heal loose. We don't want it to heal stiffer and lose a member of your team. Nobody's allowed to quit. Nobody's allowed to leave early. I got you. It's like that one employee that starts to check out at 3 o'clock. Like, oh. All right, go ahead and tilt your head left for me. Tilt left. Tilt left. Nice. Go ahead and tilt your head left.
That's weird, eh?
Okay. We're gonna do the same thing, but this time we're gonna go to the right side. Go ahead and tilt your head right for me. Tilt right. And same thing. Tilt your head right. Good sport.
Awesome. Thank you, guys.